So, I am making this video for legal purposes. You all know that I struggle with kidney stones, and I keep getting reoccurring UTIs because the stones are giving me UTIs. I was wondering, like, I could be okay one day, and then the next day I don't feel right. I'm like, what's the matter? And then I go to the doctor, and then I find out I got a kidney stone. So I'm constantly getting tested for UTIs, and then now they're saying, okay, the reason why you're getting the UTIs is because the kidney stones, this blood in your urine from the kidney stones. So we need to laparoscopy your kidney stones, break them up, and they want to break them up, and they want me to pass them. Okay, I have a history of blood clots, first of all. So any operation I get, I need to be put on blood thinners. I done already had 4 blood clots. 4. So they are considering me to have outpatient surgery. When I first found out that I had kidney stones, they put a stent in my right kidney for me to pass 1 kidney stone. And I swear I was saying I'm just ready to die because this pain is so unbearable. I really could not. It was just unbearable. Like, the pain was horrific. Now, when I had to pass that 1 stone, I was on morphine and I was on Dilaudid, 1 milligram in the IV. So now they're saying I gotta pass fragments of kidney stones. They're saying because of the opiate crisis, they can only give me narcos. To me, this is unethical, and it's almost basically like human torture, because if they tried morphine, Dilaudid, and they tried a opiate that they stuck up my butt, and none of those things helped with that 1 kidney stone, can you imagine the pain I'm about to be in passing multiple fragments of kidney stones? And the only thing that they're saying that they're going to give me is narcos. Now, they said, as I was in the doctor's office and I was talking, I said, narcos is not that. I don't even see how they could put narco and kidney pain in the same category, because that's like taking Tylenol and you got a fucking heart surgery. Like, come on now, y'all done cut my chest open and I'm in pain and y'all giving me Tylenol. But no, they're saying that I need to take narcos. I said I don't want to take narcos because narcos isn't going to do anything. I was on 3 hardcore medications passing 1 kidney stone, and it wasn't even doing any good. Why would I take narcos and torture myself? No, I'm not going to do that. I'm going to leave that hospital and I'm going to go to another hospital because the pain is going to be too unbearable to take. And so the guy said, well, they only do this because they don't want you to get addicted to the opiates. Well, first of all, everybody is not a fucking drug user. When I was in the hospital in August and I was on goddamn Dilaudid and morphine for like almost close to a month, when I got out that hospital, I was okay. I didn't take anything. No pain medications, no nothing. Nothing. So why all of a sudden now is it that I'm going to get addicted to pain medications when I just did it in August with no problem? I passed the stone. It was painful as fuck, but I passed the stone and I was good. But I was in the hospital while I did it. They want to send me home. That's one of the reasons they want to send me home on narcos. I'm like, no, you guys are not going to torture me like this. You guys are not going to torture me like this. And I'm about to make sure I keep a blog of everything that's about to be going on in the next 3 days, because I just want it to be known how these doctors are doing people. You giving people these serious surgeries, and because Susie and Becky over there then overdosed on fentanyl and Percocets, y'all try to torture other patients who really, really, really need this pain medication because they're in serious pain. So I'm just gonna put this out there, you know what I'm saying? And tomorrow I'm gonna come back on and I'm about to take y'all with me as I go through this journey of getting these kidney fragments They wanted, so wait, that ain't all. That ain't all. In order to get this, I have a history of blood clots. So with people that got blood clots, you know, every once in a while after you have surgery, you have to get on Lovenox or heparin or whatever it is to prevent the blood clots. They didn't want to put me on the Lovenox. I had to damn near beg for it because I'm like, look, I done had 4 clots. One in my lung after a hernia surgery. Well, they tell me, oh, this surgery isn't nothing. No, this surgery is something. This surgery could knock something off and I could be bleeding and a blood clot can develop and travel to my lung or my heart. So I definitely need to be on Lovenox or heparin injections after I get this. I know an officer who had operation on his toe. 2 days later, he was dead because he had a blood clot travel from his toe all the way to his heart. He didn't even have no signs of blood clots, no history of blood clots. So if I have a history of having 3 DVTs and 1 pulmonary embolism, come on now, don't play with me. Don't play with me because I'm going to get really ugly and nasty with you. And then when I get ugly and nasty, they're going to want to say, put me in a psych department and say that, you know, I'm crazy. But it's not that I'm crazy. It's just that I have very high anxiety and you are not about to just treat me any type of way. And especially, I know how much money you getting paid for this fucking operation. And you think that you just go operate on me and I'm supposed to be in pain, and then what the fuck? Like, y'all got to be out y'all goddamn mind. So this is the first video to my first procedure on laparoscopy on my right kidney. They're gonna break up the stone, and then later on down the line I gotta do it again with my left kidney because I have a kidney stone in my left kidney. I gotta do it all over again. So this is my little record of what I'm about to have to go through. So y'all just be with me because y'all really the only ones that I could talk to and vent to, because this shit is crazy. Like, how could you give somebody surgery and then I want to give them pain medication because of an opiate crisis that you got, but your patient doesn't have no type of history of addiction, but they do have a lengthy history of having health problems where sometimes they may need stronger medicines than usual other than Narcos. I don't want no goddamn Narcos. I don't even take pain medication. Only thing I take is Tylenol 650s. That's it. I don't want to be on no Percocets. I don't want to be on no Oxycontin. I don't want to be on none of that bullshit because it's not good for you, period. I don't want to be on none of that. But as I'm passing these kidney stones, I need them to take care of the pain so my fucking blood pressure won't jump up. Because then when my blood pressure jump up, then I got to get put on motherfucking blood pressure medicine. And it's like, let's avoid that before it happens. But we go see, y'all. We go see. Pray for me.